Bismillahirrahmanirrahim. This is the second lecture on asphyxia, and in the previous lecture we will discuss the general aspects of asphyxia, types of asphyxia, and in this lecture I'll be discussing further general aspects like anatomy of the neck, because these are the vital structures in the neck which needs to be elaborated and discussed. For example, the compression of neck, whether partial or complete, it obstructs the blood flow as well as breathing. यानी चूँकि दो इम्पॉर्टेंट स्ट्रक्चर हैं, ना सिर्फ खून का बहाव, वेन्स हैं, आर्टरीज हैं, नर्व्स हैं और विंड पाइप है जो एयर कंडक्ट करता है. तो प्रेशर ऑन दी स्ट्रक्चर्स, इन चीज़ों पे दबाव मुख्तलिफ़ किस्म का वेट मुख्तलिफ़ काम सर अंजाम देगा. So compression of neck, whether partial or complete, will either obstruct the blood flow or the breathing. For example, the most susceptible structure, जो सबसे नाजुक है, they are the carotid bodies. In the carotid sinus, at the carotid vessels, there are the receptors which are stimulated just by pressure, by slap or slight compression, and this will initiate excitation of the vagus nerve. And the vagus nerve, when it is initiated, it immediately precipitates cardiac arrest. Then there are veins, the venous return. You can see in the picture there are venous complexes which are draining blood from the head and neck towards the heart. And when there is compression which occludes the flow of blood in the veins, it causes congestion and even hemorrhages above the level of constriction. दबाव से ऊपर वो जो प्रेशर बढ़ेगा तो वहाँ पे congestion और hemorrhages होंगे. These are the diagrammatic representation. In the lateral view you can see the junction of carotid artery, external and internal. There are the carotid bodies and vagus nerve is shown. Similarly, on the right side is the picture which is showing the windpipe. In the center, trachea, the thyroid cartilage, the hyoid bone, and on the sides there are the vessels which are the carotid vessels. Then this diagram is showing the carotid vessels. Obstruction to the arterial supply of carotid artery will lead to anoxia to the brain. The blood supply to the brain is interfered with and it will cause anoxia. Then we know that there are other vessels which are vertebral vessels. They are running into the vertebral foramina and they are also supplying blood to the brain partially, and their obstruction or their occlusion will need much more force to prevent that flow. And this is the windpipe showing the trachea, and obstruction to the windpipe causes generalized oxygen deficiency, and to produce this compression, sufficient pressure is required to stop the blood flow, because the trachea is a rigid structure made of cartilage, and to occlude them needs much higher pressure. Usually what is done, basically the larynx is lifted up and back, so it forces the tongue backward and upward against the posterior pharyngeal wall. So the inflow of blood from the nose and mouth which is going into the trachea in the hypopharynx, that is occluded, So larynx is lifted up, it pushes the base of the tongue against the posterior pharyngeal wall, and that occludes the inflow of the air. So what happens with the effect of pressure on the neck? The slight pressure on the carotid sinus will cause the vagus nerve stimulation and cardiac arrest. And when the jugular veins are blocked, there will be congestion and hemorrhages. And with carotid artery blockage, it will cause unconsciousness. And when the airways are blocked, it will cause hypoxia or oxygen lack. And when the vertebral arteries are blocked, the arterial supply to the brain stops. So what happens and how much tension or weight is required to occlude these structures? Jugular vein just need 2 kg or 4.4 pounds of tension to occlude them. Similarly, the carotid artery needs only the 5 kg or 11 pounds. And trachea compression needs 15 kg or 33 pounds. And vertebral arteries approximately 30 kg, between 20 to 40 kg, that is 66 pounds. So this much pressure is required to occlude these structures. So when this force is applied up to this level, these structures are compressed. Then the least tension is needed to occlude the next structure, that is 5 to 10 kg, is sufficient to occlude the veins and the arteries. And the greatest tension which is required, that is 50 to 40 kg. So minimum tension, that is 5 to 10 kg, and maximum tension 20 to 40 kg. And when the hanging or the suspension of body occurs, body weight is much higher than 20 kg or 40 kg. So it occludes all the structures. Now the next important thing which is to be discussed is the fracture of the hyoid bone. The fracture of hyoid bone, there are two mechanisms are involved. The first one is direct lateral compression, that is in throttling, manual throttling, lateral compression, and this will cause the fractured segment to be displaced inward. And the other mechanism is the indirect violence by upward and outward pull, and this will cause the hyoid bone fractured segment to displace outward. So direct lateral compression will cause fractured segment to move inward, whereas this happens in manual strangulation. And the second mechanism, there is indirect pull upward and outward on the limbs of the hyoid bone, and this happens in hanging. And in this, the fractured segment will be displaced outward. So in manual strangulation, there is lateral compression and the fractured end will be displaced inward. And in hanging, there is backward pressure from the front, hence the fractured segment will be displaced outward. The fracture of hyoid bone and laryngeal cartilages, they occur in elderly people because these are cartilaginous structures and they are ossified after the age of 40. These fractures are seen after the age of 40 because hyoid bone fuses after 40. These are the various pictures, and here you can see the fractured segment, they are displaced inward and the fracture ends are displaced outward. Now again we'll go through the classification because now we'll be discussing the specific asphyxial death. As we are concerned with the mechanical asphyxia, the forensic medicine is mainly concerned with the mechanical asphyxia, that is the mechanical interference with the process of respiration. And it is either occlusion from outside or occlusion from inside. When we say occlusion from outside, it can be obstruction at the respiratory orifices, that is the suffocation, and this can be achieved by smoothing and overlaying. And the other is the obstruction at the level of neck, which happens in hanging and strangulation. And then the obstruction at the level of chest, that is stampede or traumatic asphyxia. And then a special type of asphyxia, which is autoerotic asphyxia, we'll discuss in the later lectures. Now, occlusion from within, it can further be subdivided into gagging and choking and drowning. They are all occlusion from within. The obstruction at the level of neck can further be subdivided into hanging and ligature strangulation and manual throttling. And ligature strangulation can be either garroting or throttling or mugging and barnstorm. This is mugging, bending, compressing the neck in the arm lock, and lower one is the Barnsdorla. The neck is compressed between two sticks. Now the suffocation. We start with the specific asphyxia, that is suffocation. Suffocation is defined as the mechanical obstruction to the passage of air into the respiratory tract by means other than constriction of neck and drowning. So that means the entry of air into the respiratory tract is blocked at the nose and the mouth level, not at the neck or drowning. So it is the mechanical obstruction at the level of orifices. And this is said as the purest form of asphyxia because there is complete blockage, because we know that air into the lungs can only enter from nose and the mouth, and when these two are blocked, air cannot enter. So this is the pure form of asphyxia, and this results rapidly into a painless loss of consciousness. The person becomes immediately powerless, unconscious, which is followed by death. The types are, it can be smoothing and it can be overlaying. This occlusion can be achieved by gagging, by choking, and by barking. Barking is another phenomenon I'll discuss. Now, smoothing. This is the closing of air passages, that is the nose and the mouth, either by hands or by any other soft material. And overlaying, this occurs in small children. They are overlaid by someone who is sleeping by the side, either the mother or the father or anybody who is sleeping by the side and is overlaid. Now the occurrence is accidental, suicidal or homicidal. This is most commonly accidental in overlay. We have seen the cot death in infants due to prone position also. The burial of face in the soft pillow, or accidentally covering children, covering their face with the plastic bag, and also in epileptic. So in these situations, it is accidental blockage of the external respiratory orifices. Suicidal is uncommon, and homicidal, it in adults is impossible, but it can only be done in feeble and weak or intoxicated individuals. What is the mechanism of death? Either it is hypoxia, that means reduced supply of oxygen, or anoxia, that is complete blockage. Now we'll discuss in detail the smoothing. Smothering is a form of asphyxial death caused by mechanical occlusion of the external respiratory orifices or passages, that is, mouth and nose. And the nose and the mouth by hand, by cloth, by plastic bag, or any other material. So basically, the entry of air into the lung is blocked at the nose and the mouth level. And this can be achieved by any means. And what will be the autopsy finding? There are specific pathological finding at the locus. That means the occlusion is at the mouth and nose, so the finding will be limited here. So specific pathological finding here will be abrasions and bruises, which are generally seen in mouth and nose. And they may be absent if the soft material is used or some cloth has been applied. Injuries on inside of the lips because of the pressure against the teeth, bruising of the gums can be seen. So autopsy, when you perform, you should open up the mouth, lift up the lips. You should see the inside of the lips and the gum for these injuries. And these injuries can commonly be missed if you do not examine the mouth. So this is a picture of a homicidal smothering and the injuries produced as a result of struggling, and therefore they may be absent in infant because they are weak, they are feeble, in young children, in aged, and in debilitated person because there is no resistance. The air passages often contain blood-tinged fluid because when there is hyperemia, there is congestion, there is rupture of blood vessels, there is secretion of mucus, and this mucus is mixed up with the blood, and these blood-tinged fluid will be found in the respiratory passages. Now regarding the non-pathological, non-specific finding pathological, we have discussed in the previous lecture. They are cyanosis, congestion, petechial hemorrhages, fluidity of the blood. They will all be present on the skin and on the internal viscera. These are the petechial hemorrhages. Now we'll discuss the smothering by plastic bags. The incidence of accidental obstruction of the air passages by the plastic bags is increased recently. The moisture, it seals the respiratory orifices by the plastic. When the children accidentally cover their face, and with the moisture of the breath, it clings up. It sticks to the face and the orifices, and the orifices gets blocked. And the material, which is glue-like material, will be detected in the blood and the liver when you examine them. Now regarding the medical aspects, smothering is mostly accidental. It may occur in alcoholics who roll over and bury their face in the pillow or in the bed. Or epileptics may also bury their face during the fit and can also suffocate them with some suffocating material. Then at birth, sometimes the newborn may die from smothering if they are born with membranes covering their nose and mouth, and that is called as caul birth. And the alcoholics who roll over and bury their face in the pillow when they are in bed. Now the overlaying. Overlaying is an accidental smothering of a child due to mother or any other person rolling over it during sleep and thereby asphyxiating the child. And sometimes it occurs when the inexperienced girl presses the child too closely to the breast and while feeding, and the neonate gets suffocated. And sometimes there is homicidal smothering, which can be committed by closing the mouth and nostril with hands. and it may also be committed with pillow or any other cloth. It is common method of infanticide. Homicidal smoothing in adults is difficult unless they are weak or they are stupefied with the drugs. Now burking. What is burking? This is a form of asphyxia which was invented by two murderers, Brooke and Hare. And they used to kill their victims and sell their bodies for dissection to Edinburgh Medical School. The Brooke used to sit on the chest of inebriated victim, alcoholic, drunken, and Hare used to cover with one hand the mouth and the nostril and pushing the jaw with the other hand. So it is a mixed traumatic asphyxia when the Brooke used to sit on the chest and chest was unable to move, and the other guy used to block the nose and the mouth, and that is smoothing. So it is a mixed smoothing and stampede. And sometimes they used to drag like a wheelbarrow, just mimicking a road traffic accident just to disguise the scene. And this method is a mixed example of smoothing and traumatic asphyxia. Now, what are the internal respiratory obstruction? There are two types: choking and gagging. Choking. Choking is a form of asphyxia which is caused by mechanical occlusion within the air passages by some solid object. That is inhalation of some solid object into the respiratory passages. And this object excites violent coughing to get it out. But when this is unsuccessful in expelling that object, then the choking results. And this is important. The size of the object is not important, because even a small object, when it touches the lumen of the respiratory passages, it will excite intense spasm of the vocal cords and fatal consequences will result. In epileptics, the tongue may fall back against the posterior pharyngeal wall during the attack and may result in choking. Now, Heimlich maneuver is important and everyone should learn it. Lean the person slightly forward and stand behind him or her. Make the fist of one hand. Put your arm around the person and grasp the fist with the other hand, like this. And put it high up on the abdomen just below the rib cage. And make a quick, hard pressing movement up and above. So this is how it is achieved. And this violent compression can expel the air, and with this the hard object will be expelled out. Now, what is the cause of death? The death results from asphyxia, from vagal inhibition, or laryngeal spasm. Laryngeal spasm will again cause asphyxia. Now, gagging. Gagging is a mean to effect choking by preventing a fair entry through the mouth and nose. That is, something is gagged, pushed into the mouth, stuffed something into the mouth. And the gag commonly used is handkerchief or any piece of cloth which is stuffed tightly into the mouth. And it not only fills the mouth but also obstructs the breathing through the back of the throat. And this is important, that the gag, when it is packed, choking only will occur when the saliva, the mucous secretions and the edema fluid, it will moisten the gag and the pores of that cloth will be blocked, and then only the breathing will be stopped. The entry of air will be stopped. Now, while the autopsy findings, The tongue should be specially examined for the position and the presence of bruising or the bite mark before the dissection of neck or removal of the viscera. And in post-epileptic choking, the history of fit, the tongue bite, and the position of the tongue is important. In choking due to foreign body, in addition to asphyxial finding, you can find the object which is responsible for uh, causing the choke that will be found in the respiratory passages. And you can prevent the choking in children by the Heimlich maneuver. Now, regarding the medical legal aspect, death from choking is always accidental. It arises from impaction of food, impaction of fish bone, impaction of denture, or any other foreign body. And in alcoholics, the vomited material may be inhaled, aspirated. And in children, small objects like the marble, the coins can be engulfed. Then the impaction of pee may occur in children. And these are various objects which were recovered. The homicidal choking is usually confined to cases where the infanticide is done, where all sorts of foreign articles are introduced into infants which are available. Then suicidal choking is rare. And gagging is always homicidal. Gagging is always homicidal. Now the cafe coronary. Cafe coronary is a condition of accidental choking where a bolus of food produces complete obstruction of the lamina. As this happens usually in cafe, and it looks like a coronary attack or heart attack, that's why it is called as cafe coronary, whereas this is a choking. The victim of such accident slump over the dining table and with little or no cry. He cannot utter a word, he cannot call for help, just mimic on the table, and everyone thinks that he has suffered from heart attack. So it is because of this it mimics a heart attack. It occurs commonly when the gag reflex is suppressed, like in alcoholics and intoxicated individuals. And death is due to reflex cardiac arrest consequent upon the stimulation of laryngeal nerve. The autopsy will reveal a bolus of food which is impacted in the larynx. This was an case where the bolus of meat was recovered. Now, entrapment. When the person is entrapped in a closed environment, initially the oxygen is available, but later on, because of the reduction in oxygen, it will lead to asphyxia. Entrapment of a child in refrigerator, in a wooden box or a cupboard, they are usually accidental. They are a habit of playing hide and seek and closing them into the cupboards and such spaces. Now the positional asphyxia, like in wrestling and uh, other, you can see there is kinking of the trachea, the bending of neck backward or forward will kink the trachea. So, any question if you can write in the comment box. Thank you very much. Take care. I'll continue this picture in the next lecture.